The Affordable Care Act has been a political lightning rod from its beginnings, and health insurers, too, were hard-pressed to find financial success given the rocky start. But as we fly past the 5-year mark of the implementation of the landmark health reform law, with a new enrollment period set to begin soon, health insurers are now seeing the highest underwriting results and net income than at any point during this time. I'm John Weber for AM Best TV. Here to look back and discuss the current state of the ACA are AM Best Health Rating Analyst Doniella Pliss, Director, Sally Rosen, Senior Director, and Jason Hopper, an Associate Director on AM Best Credit Rating Criteria and Research Team. And Jason, when we talk about the ACA, we can't help but talk about the politics of it all. There have been numerous attempts to alter or repeal the legislation. How much of a detriment has this tug of war been for insurers?
Regardless of industry or sector that companies participate in, I think the main thing that they look for is stability and certainty, and that has not been the case in the health insurance industry. Going all the way back to 2011, a judge ruled that the individual mandate was unconstitutional, and that happened before the law even took effect in 2014. Late in 2015, CMS announced that risk corridors were being reduced to 12.6%, only a fraction of the money that health insurers were expecting to receive. And this announcement was made after 2016 rates had been filed, so this continued a further drag on earnings for health insurance companies. Late in 2017, the federal government announced that they were no longer funding CSR subsidies, but insurers were still required to reduce cost sharing to low-income consumers, so that also had a negative effect. There were issues around short-term limited duration medical plans. Medicaid expansion was also an issue. It was originally a mandate applied to the entire country, but a judge ruled that down as well. So that is uneven throughout states. And there's been advent of Medicare to work requirements as well, and that will continue, or that has continuously gotten legally challenged through the courts as well.
Is there anything else creating uncertainty in the marketplace?
I think most eyes at this time are watching the case that went through Texas, whereby a judge ruled or struck down the individual mandate of the ACA, and therefore the entire law should be stricken down as well. Oral arguments were held in July, and the decision is currently pending. Ultimately, we expect this to move up to the United States Supreme Court, so we will see how this plays out.
Doniella, one of the big issues you've talked about since day one is the makeup of the risk pool. How can this be problematic?
In order to understand that issue, we have to go back to the very beginning of when the exchanges were first introduced. And when the insurers priced for that, the assumption was that everybody who currently had individual policy will come in and participate in the ACA exchange pool. But then, not long before exchanges went live, President Obama came out and said, if you like your plan, you can keep it. And millions of people who were on individual policies at the time decided to keep their policies. As such, the risk pool that came into the exchanges turned out to be very different compared to what insurance had been pricing for. And that's where insurance industry struggled, because the profitability was not good, to say the least, and the losses came right on the first year and the second year before the insurance were able to adjust to reflect the current situation.
Sally, individual commercial enrollment surged upon implementation of the legislation, but has subsided in recent years. Can you explain that dynamic?
Sure. Well, first of all, the surge was because many people were uninsured, who were previously uninsured, elected to take coverage in the initial open enrollment years. The slight decline has been driven by several factors, one of which has been the improving job market, which has led to fewer people needing to buy individual coverage and more people getting their coverage through their employer, as well as the implementation of short-term limited duration medical plans. Some people have opted for that as the premium has gone up on the individual policies, and some people have dropped coverage either to elect to go uninsured, to take a short-term limited duration plan, or some have, with the elimination of the mandate, have just dropped coverage altogether.
Now, Medicaid premium has soared due to the expansion of those programs in a number of states. Doniella, if the law was struck down and those new enrollees were dropped, what do you think the industry impact would be?
First and foremost, industry will face a significant increase in uncompensated care because the individuals that are on Medicaid tend to be sicker. They often have chronic conditions, so they will need medical care. If they don't have Medicaid coverage, they will just show up in emergency rooms or will just be hospitalized without coverage. And the industry will see the rise in this uncompensated care. To offset it, the hospitals and providers will put pressure on the insurance on the commercial side and on Medicare Advantage side to increase the rates. So that would be a very significant consequence. From an insurer perspective, in addition to that, if Medicaid rolls are reduced, insurers can face scale problem because a lot of them build significant capabilities to service this population, and the operating expenses that they incurred and continue to incur are obviously offset by this Medicaid premium that they're able to receive. If they cannot receive this premium, this admin expense will become a burden.
Now, all of these issues and others were part of the adjustment period that insurers had to work through to bring them to where we are today. Sally, what other main adjustments did insurers make?
Obviously, for the individual product, there were multiple years of rather large rate increases, which were driven by the risk pool in the population and the experience that was being seen. Additionally, they instituted narrow network plans, and many companies enrolled individuals with chronic conditions in care management or disease management programs, which enables to ensure that these people get the most appropriate type of care for their medical condition.
Doniella, how do the companies that you speak with feel about the ACA, and what does AM Best foresee going forward?
I would say that majority of companies we talk to feel relatively optimistic about this block of business. It's been a very good source of profitability for them over the last 2 years. And for some companies, it was the most profitable line of business. The companies are pricing closer to trend in this line of business, and they expect earnings to moderate, but they still expect this line of business to remain profitable. And even if there is a change implemented as far as eligibility or any type of change in, let's say, government subsidies and eligibility for the subsidies, insurers are pretty optimistic that it wouldn't be right away, and they can still be flexible.
And then with regard to what does AM Best foresee going forward, I mean, we do expect the Trump administration to continue to implement changes that will continue to chip away at the law. We do expect more states. We are seeing more actions by the state regulators, so we're starting to almost go back to pre-ACA with different legislation and different rules by the states. We don't foresee any repeal and replace at this point, given the differences and the splits in the parties in the House, the Senate, and the President, and the fact that we're going into an election year. We do have 2020 as a presidential election year, and AM Best is going to wait and see what happens there and who gets elected and what their proposals are.
Sally, Doniella, Jason, thanks for taking the time to speak with us today. The ACA 5 years on, you can find the full report online at ambest.com. And for AM Best TV, I'm John Weber.